Hi, my name is Christy Reed, and I'm here today to discuss with you the nutrition-focused physical exam. I will present a introduction as well as a simulation and a conclusion today, and I want to talk to you about how common malnutrition can be. It is shown to be in practice settings, especially in hospitals. It affects all ages, children, adults, the elderly. And when malnutrition is present, it can affect the muscle where we become very weak. And people who present malnutrition come into the hospital with an increased risk of infection, an increased risk of falling, and also they have a decreased quality of life overall. And those with malnutrition can also are likely to suffer from pressure ulcers or injuries, and also an increased length of time in the hospitals. And hospitals are also revealing that there are an increased readmission rates when it comes to malnutrition. So there is no single parameter that can diagnose malnutrition, but there are 6 clinical characteristics that we as dietitians need to look out for. 2 of the 6 clinical characteristics can be identified and diagnosed for malnutrition if a patient has 2 of these 6 at least. And these characteristics include an inadequate food or nutrient intake, also weight loss and loss of subcutaneous fat, muscle loss, localized and generalized fluid accumulation, as well as reduced grip strength. Nutrition-focused physical exams are part of the nutrition care process, and they're so important to help us identify patients who may be suffering from malnutrition. So next, I will show you a simulation of what it would be like in order to conduct a nutrition-focused physical exam. So let's get started.
Hi, Riley.
Hello.
I'm Christy, and I'm the nutrition intern. And I really appreciate you partaking in the nutrition-focused physical exam. It's a really important part of our training, and it's also a really important part of our occupation. And we are assessing from the nutritional standpoint of your muscle and your fat integrity. And so it's very important that I'm not only just looking at you visually, but also I'll be palpating you, which means just kind of applying pressure to different parts of your body. And I will be assessing for, like I said, for your muscle tone and for your fat as well, and from the nutritional standpoint. And I will be starting at the top of your, like on your face and a couple of areas around your temple and also around your eyes, and then I will be moving out towards your neck area and your shoulder area. Then I'll be touching a little bit on your back shoulder along your rib cage. Then I'm going to come up underneath your tricep area and move down to your hands, and that'll be the top part. Then I'm going to come down to your lower extremities, just around your knee and your thigh and your calf area. All right, so I'll go ahead and begin.
Okay.
All right, so I have gloves on, so hopefully it won't make it uncomfortable for
No.
you. If there are any areas, are there any areas on you that are sensitive
No.
or tender?
No.
At all? Do you have any injuries anywhere that might be like a broken bone or anything like that? So you're pretty much even on both sides?
Yep. Yep.
Okay, very good. So I'll go ahead and start at your temples. And so I'm going, can you let's see, as if you're chewing,
Okay.
so we can flex the muscles up here in your jaw area. Great, and then just kind of chew as if you're chewing. Make sure I'm in the right area. So I'm going to go ahead and use a couple of fingers, move in a scooping motion. That's wonderful. Okay, thank you. And you're flexing right now?
Mm-hmm.
Okay. And then go ahead and not flex. Great, now I can tell the difference. And flex again. Okay, great. Okay, go ahead and try the other side. Okay. All right. And to just palpate right underneath your eyes. We want to look up, so there we go. Use 2 fingers. Very good. Thank you. So I'm going to move down now along the side of your neck. And I did miss an area on your base, which is like right in here. I checked first, and I'm going to go underneath your cheekbone there. Okay, those sides. Great, thank you. So then I'm going to slide down your neck here and feel the integrity in your neck, and check out your clavicle. Get yourself a nice tattoo there. Probably shouldn't say that to a baby. Okay. So then I'm going to go above your clavicle and check out in this area and move out towards your shoulder. And I'm just feeling around your shoulder area and towards the back. And then if you can, just sit up straight. Oh, there you go. And I'm going to ask you to just grab my hand, and I'm going to apply some pressure, and if you could pretend like you're pushing up against that wall there. Okay. Great. I'm just going to engage your back area right in there. Great. Along your rib cage. And then right below your shoulder area. Very good. Thank you. Okay, then we'll go ahead and move up along underneath your tricep area. Go ahead and bend. There you go. And just relax. Okay. And then along that area, separating your muscle, which is nothing but muscle here, right in the middle. Okay, that area there. Perfect, thank you. Okay, so then we're going to move down to your hand, and if you could, both of your hands, go ahead and form little round OK signs.
Okay.
And so what you're going to do, when you're pressing these two together, you're going to push them rather, firmly. So I'm going to be feeling right in this area here. Oh, wow, you've got a nice muscular tone. I'm going to push with 2 fingers there. Very nice, thank you. And then always checking the other side, which is different. Very interesting. This one is, are you right-handed?
I am.
Okay. Yeah, that's very interesting, very different. But definitely prominent in both. Thank you so much. So now we've done the top part, and we're going to move down to, just go ahead and put your knee back in like it was. There we go.
Okay.
Okay, so first thing I'm going to do is notice where your kneecap is. And does that feel about right? Okay, so we're going to check out quadricep right here. So, you need to scoot forward.
Okay.
And engage yourself. That way, we're not putting all of your muscle tone upwards.
Okay.
So it's more evenly dispersed.
Okay.
Okay, great. Thank you. Okay, so first thing I'm going to do is kind of just notice the integrity and run my hand along this way and along it here. And then I'm going to extend your knee out. There we go. And I'm going to check your calf.
Okay.
Okay. And if you would just flex forward and backwards. There we go. So I'm just feeling the calf muscle engaged. Very good. Wonderful. Thank you. Let that back down. So I'm going to just check this other side and make sure that it's even. Showing it here. Feels great. Go ahead and extend. Perfect. Wonderful. Thank you so much. Okay. Do the face. Do the face again. Okay. All right. If you don't, do you mind if I do the face
No,
again?
that's okay.
Okay. So we'll start. Can I do it
Sure.
straight on?
Yep.
Okay. So I'm going to go ahead and do both sides, and if you'll just flex.
Okay.
Great. Okay, perfect. Okay, so then I'll go underneath. Wonderful. Okay. I'm noticing the curvature of your neck for muscle integrity, and also looking at your clavicle area there, and I can feel exactly where the clavicle is, and I'm running my finger down below and noticing that your muscle goes directly over the clavicle, and then it's also, I can feel all the muscle tone all in through the side. And then, same exact thing on that side. Great. Look good? Okay, thank you. You're welcome.
All right, I hope you enjoyed that simulation. Next thing I would like to discuss are micronutrient deficiencies. For that component of the nutrition-focused physical exam, we can make sure to look at the patient's nails and make sure, look at their hands and look at their nails and make sure that the nails should not be brittle, and they should not be spoon-shaped, or they should not have any ridges. This could indicate a micronutrient deficiency. Next, we would want to check their hair and note if there is any brittleness, any sparse or deeply pigmented areas, or any areas where the hair easily comes out. And these types of indicators can indicate micronutrient deficiency as well. Next, you would want to examine the patient's mouth. You can, using your gloves, you can ask if it is okay to open up their mouth and take a look inside and look at the gums and make sure that they look nice and pink, that they don't look like they're easily bleeding, and they're not spongy or swollen or red. And additionally, you would want to look at the tongue and make sure there isn't any swelling, and it shouldn't be really raw looking. And also the patient's lips are really important. We all can get some cracked, dry lips, but they shouldn't be so dry or scaly or any swollen or cut marks on them. That can also be signs of poor nutrition. So I hope that overall this was a very useful simulation, and I look forward to doing this in person to answer any questions for you in the future. Thanks for your time. Bye.